So we've got a member spotlight here today that I want to have her share her story. Not only is she an Impact member, she's also a referral partner. And if as you're listening to the information today, you say, you know what, I can get behind this, man, I want to share this with other people. Man, I want to be a part of the crusade to disrupt the broken healthcare system. Get back to the person that invited you on the call at the end of the call to say, I want to learn more about the business opportunity here on how to earn residual income. This is one of our top referral partners. And wait till you hear her story with her mom. And let me tell you, when you have something that touches your heart personally, that goes out and makes a big impact, pun intended, on your family, it becomes very easy to share your story and what it can do for other people. So Chanelle, Burt, thank you so much for being on the call today. And I'd love to turn it over to you to share your story. And I think you're going to actually show some medical bills as well, as far as how Impact reprices the bills for the members. Thanks so much for being on.
Well, thank you so much, Mr. Street, for having me. I love that you and Ms. McQueen and Ms. Street host this call every single week to really give people a lot of information when it comes to impact, because yes, I just to tell you guys a little bit of my background, I used to be an electrical engineer, and a little over 17 years ago, I started a part-time business, and it was really to help my mom financially because she's a cosmetologist. She has no retirement. Anytime somebody cancels a hair appointment, she doesn't make any money. And I am her only child. So I decided to start a business to help her out financially. And I can clearly remember when I was having success and I told my mom, I said, you know what, I'm thinking about doing this full time. I'm thinking about walking away from my job. And the number one thing that she said to me was, well, what about your benefits? And I said, well, I'll just pay for my benefits just like you. Well, little did I know that, fast forward, I would be married, have 4 kids, and we will be paying close to $1,600 a month for healthcare. But I also didn't know that my mom, like so many other millions of small business owners, don't have healthcare at all. So, here was an opportunity when I started becoming a referral partner for Impact. I was able to get my mom on the service. And what I also didn't know, that just a few months later, guys, she would be diagnosed with breast cancer. Now, I know the first initial reaction is, oh my gosh, I'm so sorry. But thank God, God is good. She's been doing amazing. But, when she got diagnosed, I was so excited because she had Impact Healthcare. And over a year or so before she was diagnosed, I just so happened to be connected to one of the top 1% doctors in breast imaging that's in DC, but my mom lives in Baltimore. So, the number one thing that I remembered was Impact Health Sharing said that there were no network restrictions. So she could visit any doctor, any facility that she chose. And that's exactly what happened. I called the doctor that I knew. She said, get her into my office right away. We'll take care of her. And just like they were saying, there was some pushback when we went to the facility because they had no idea what Impact was. They were simply saying, well, we don't take this. And I said, well, yes, we do. And they said, well, you don't have enough coverage. I said, yes, we do. And the number one thing that really sold me out to Impact was that they needed to do an MRI for my mom. And the nurses were saying, well, we need to get pre-authorization from the insurance company. And we called Impact. And they said, no, you don't. We don't do that. You don't need pre-authorization with us. If the doctor says her mom needs it, then you do it and you just bill us. And what I found out that day, guys, was from the nurse herself. She said that most insurance companies will not pay for an MRI. So there are women going to get seen for breast cancer today that will not get the proper care that they really need because of the insurance companies and the pre-authorizations that are getting denied for them to get the best care possible. So what I want to do today is I want to go through a typical day that, happens with me and my mom, because my mom has had to go through once a week for 12 weeks of treatment. And then we started once every 3 weeks for treatment. And we had to do that for four times. So I am excited to share that we only have one more treatment to go. And then she's done. So I'm so excited about that. But I'm going to take you guys through a day of what happens, because as we know, when you go to a doctor, you are charged for every little thing, right? All right. So I'm going to show you what happens with us. So let me just share this really quick. And so this is what happens, okay? When we go to the doctor, first she has to get her blood drawn from a port, and we get a bill from LabCorp, as you can see at the top, for $157 every single treatment. Well, because we had already met our PRA, one of the best things about Impact is that they've repriced your medical expenses, just like they've been talking about today. And they saved us over $100 for the test, for the blood draw. But as you can see, that was also eligible for sharing, guys. And my responsibility, and I'm going to say because I'm the one that takes care of all of my mom's bills, I only had to pay $5.36. Okay, so that's just the first part. Then she has to get some meds, before her actual treatment. And this is just one medicine, guys, that we were charged $357. And this is from the facility themselves. But after repricing and after sharing, my responsibility was only $94.75. But here's what I really want to show you. Here is one of the big ones, because she has to get her chemo, she has to get meds because of her anxiety, and she was charged over $6,000 for this. But Impact, as you can see, saved over $3,700, and my responsibility was only $289. Now, if you paid attention to this, why I say this is just going through a typical day, because the service dates were all the same, okay? And I'll just kind of backtrack so you can see all the service dates are February 5th. Okay, so this is just literally showing you what really happens during a typical day when my mom and I would go to the doctor for her treatment. And this was every single week for 12 weeks. Okay, so what I did today, I simply pulled out the calculator and I was calculating what the cost would have been had we had no coverage whatsoever. Because remember, just like I said, she had no health care prior to Impact Health Sharing. So this was the total cost just for that particular day. Okay, over $7,000 we were charged. But because of Impact Health Sharing, guys, look at what I ended up paying. $389.66 for that day of treatment for my mom. And so, a lot of, people that are looking at this, they think about, well, what if everything isn't covered? What if I haven't met my PRA yet? What if I have pre-existing conditions, just like Ms. McQueen was talking about? Well, anybody can be on Impact. And even though everything may not be covered, they would still reprice your medical expenses. This is why this is so exciting for so many people, because I even broke it down. Had it not been eligible for sharing, we still would have just had to pay over $3,000 because of the repricing of the medical expenses. And guys, here's another bill. I can show you tons and tons of bills that I have, but here's another one where we had to get treatment and a heart echo, where they take, test about your heart to make sure your heart is okay when you're getting these chemo treatments. This shows you that it came in at over $7,000. Impact Health Sharing saved us over $6,000. And after sharing, my responsibility was only $93.49. So, ladies and gentlemen, this Impact Health Sharing, we talk a lot about the savings, but it has truly saved my mom's life, because all I think about is, what if we didn't have Impact? Where would we have been? Like, what would have happened financially? And listen, I was already helping my mom financially, building my business part-time, right? Here we are faced with breast cancer as her only child, and I was going to have to help out financially once again. Now, I am married, I have 4 kids, I'm a travel baseball mom. My in-laws live with us. We have a lot of expenses that happen on a day-to-day, for my family. And for us to have to help out financially for medical expenses today, Impact has been a complete blessing for all of us, myself, my husband, my mom, because my mom, all she thought about was, how am I going to pay for this? You know, the number one thing she thought when she got diagnosed was, one, am I going to die? Right. And because of our faith, I said, listen, everybody's going to die, but breast cancer doesn't have to kill you. Right. And she looked at me and she said, man, you don't look worried. And I said, well, I'm not. Number one, we have faith. And this is not the time where we can, waver on our faith. But number two, we have impact health sharing. So I'm not worried about the expenses whatsoever, because one, you can be under the best care with some of the top doctors in our country today, and we can save a lot of money as well. So I am truly, truly grateful for impact health sharing, guys. This has been a service that we are literally, when we say we are disrupting the healthcare industry, the broken industry that all of us are seeing today, seeing is believing, right? And this is why I like showing the bills that we have been, accruing from the hospital and from LabCorp. It's just been a blessing. The Impact Healthcare, staff has just been fighting for us, because when they didn't think that they could accept it, all they did was say, have them call us. We'll take care of it. When your mom needs to get tested, we'll even find a facility that doesn't even charge as much. So they have really been standing behind us and really fighting for everything so that we could be in a better position for our finances when it comes to our healthcare. So I'm so excited to be on sharing this with each and every one of you. I know some people, when you first see this, you're kind of like thinking, well, wow, this is too good to be true. How are they doing this? We were the exact same way. And I'm just grateful. I log into the back office all the time to see all of the things that are being sent, but more so the prayers. The community is just so amazing, because you get to see everybody praying for each other and everybody really being so thankful for this Impact Health Sharing community. So thank you guys so much for having me on, being able to share. And, in myself and my family, we were paying close to $1,600 a month, guys, but now we only pay $605 a month for all 6 of us. So thank you guys so much for having me on, and I'll turn the call back over to you, Mr. Street.
Well, Chanelle, $1,000 a month in savings for your family, but a lot more importantly, what they've been able to do to go out and help save your mom, who was one of those 26 million Americans that had no healthcare coverage prior to Impact. So thank you for being an amazing referral partner. Thank you for sharing your story. And you guys see how amazing this can be from a member standpoint. But I want to also talk about a physician standpoint. We have Dr. John Witcher on the call here today. Dr. John, if you could maybe just take about 2 or 3 minutes and just share from a provider standpoint why you're so passionate as a provider about really medical freedom and what Impact is doing.
Yeah, thank you, Jeff. Appreciate you. Yeah, so my wife and I, we got involved with this business about 2 months ago, but Impact Health, we've had MediShare for the last 10 or so years. And so we understand health sharing. And, like Jeff mentioned earlier, the CEO of MediShare broke away from MediShare and got with Phil Chrysler, and they've put together this Impact Health. And what we like best about Impact Health, it looks and feels more like insurance, in that you have an insurance card. And so it's not like the reimbursement model. You don't have to necessarily negotiate your prices up front. You give them the card, you flip it over, and it's got the information on there that the doctor or hospital can bill electronically. So that's important. Of course, the savings is tremendous, but in the medical freedom movement, you have a lot of us doctors that are really, we understand what commercial health insurance is. It's unfortunately, it's a broken system. They dictate to doctors how to practice medicine, and Impact Health will never do that. Impact Health, they're going to allow the doctors to practice medicine, to take care of the patients. And so this is just a win-win situation for the medical freedom movement. Patients are going to be able to choose what doctors and hospitals they want to go to, have the cost effectiveness that they're not, it's not, they're going to save 50 to 70%. And so, we're wanting to build this parallel health system in the broken healthcare market. And we believe that Impact Health is going to help us do that.
Well, Dr. John, thank you for your testimonial, and just so powerful, the fact that Impact doesn't dictate how a provider diagnoses and treats their patients. And I know you guys love the fact that you can now get paid from Impact in under 18 business days time on average. And